We had a measurement of the labial aspect of lateral incisor that will be dependent upon for measurement. We have a two measurement as cervical line, and we have two measurement in the holes of the crown. Okay, so you can see the measurement at the cervical line. It was 5 millimeters only. You can make a double check to this measurement. This is a 5 millimeter. So we have two dots here and the cervical line. It will represent the minimum width of the crown at the cervical. As well as we had a 6 millimeters, but not correspondingly lined in the well level. We had one at the junction toward the cervical. This represents the contact area. So we need only 3 millimeters here. Otherwise, in the other side, we had a 3 millimeters at the incisal third, but towards cervically. It's not at the junction between the middle and the incisal third. Just toward the junction, okay? Because we will still in the anterior teeth. So the anterior teeth contact area, it will still in the incisal third, but in the central incisor is toward the incisal third, toward the incisal edge. In the lateral, it will be decreased, okay? So this is a 3 millimeters. You can make a double check. This is 1, 2, 3. 1, 2, 3. So this is a 3 millimeters. This is a 3 millimeters. You can leave 0.5. This is not a problem for a carving in the further stage. So the labial aspect, it will be accomplished by this measurement. And be sure there is a 10.5 for the length of the crown. So we need 10 millimeters or 10.5 is not problem, not big deal. So this 0.5 I will make it increase, not decrease. So this is a 9 millimeters we had here to represent the length of the crown. Make a double check. This is a 9 millimeters. So this is my labial aspect of the lateral incisor. So within this stage, I can make a management to my carving. So after that, please make a double check for the labial aspect. Don't start with the distal aspect or mesial aspect. Make sure all measurement is good. Make sure this surface, it will represent one line, one aspect within this outline, okay? So we will depend it upon what? As we mentioned in the previous lab, we will depend it upon the measurement and the shape. So the measurement is not completely, I cannot adopt it for the shape. The measurement, it will represent only minimum width and maximum width. I will add it another information that will relate it to the shape of the lateral. So when I had a minimum width and I had a maximum width, so the minimum width as cervical, the maximum width at the maximum curvature. So I will start with the maximum curvature to complete the outline of the lateral incisor. Where is the difference in the lateral incisor of the outline in the labial aspect? We had a round shape. We have a round shape. You can see here in our reference for the lateral incisor. You can see we have a rounded shape. We don't have a sharp angle like in central incisor. And you can see this is a distal aspect, this is a mesial aspect. For the distal mesial aspect, it is slightly convex, okay? There is slightly convex or convex, okay? So we have a severe roundation here at the mesial. This is the contact area. And we have a small area of the incisal edge because we will start with the other roundation in the distal aspect, severe roundation. This roundation is, the length of this roundation is more than at the mesial aspect. So we can see we have slightly concave. Okay. So other feature, it will be described within the carving. Just make a rounded shape to the labial aspect. Okay. This is regarding to the shape of the lateral incisor from the labial aspect. What I need now, I need to elect mesial or distal. There is no big deal with this selection. To what? To draw the outline, to assign the outline from the distal or the mesial. Because I will make it 1D from the labial and I start with the 2D. So my hand, my carving, it will add 3D and 4D. Okay? 3D, until 3D. I will add the features upon the correct outline. Okay? So, what I need in the distal aspect, I will start as I am a student. For the distal aspect, I will go to my reference. So this is, I accomplished this stage. So I will go to the other slide. So you can see this is the distal aspect or the mesial aspect. So this is the shape, triangular shape, but we have a curve here. You have a maximum convexity at the cervical third, as in central incisor. And we have a curve toward the incisal edge. So we have a roundation here. We will start with a concave shape and the maximum convexity at the cervical third. That reveal we had a maximum width at the cervical third. So there is no other measurement. I can adopt it with this session just at the cervical third. But for additionally we had another measurement in the cervical third at the start point. So this is for what? This is for the whole crown. Please pay attention. This is for the whole crown because I don't have any measurement here. There is no measurement here. I will depend it upon the shape. So I will start with the measurement of the whole crown. You can add it another one at the cervical. So we have a 4 measurement, but unfortunately all of them in the cervical third. But there is no problem because I had what? I had the length of the crown. Okay? And I will add only the shape to this area. So you can see this is the length of the crown. We had a 9 millimeters. So this is the length of the crown. So otherwise, I will use the I would use the labiolingual diameter of the crown and labiolingual diameter of the other cervical. So there is no difference. You can assign only 5 or only 6, or you can assign both of them. Okay, there is no any difference, but it will produce the edge at the cervical. It's for what? For a professional work. Okay, so I will assign it. I need this measurement now at the cervical. This is 5 millimeter only. So sorry. This is a labiolingual. Sorry. This is 5 millimeter and we have a 6 millimeter. So we need now the measurement of the labiolingual at the cervical. What does that mean? What does that mean now? I need the labiolingual. This is the labio. Okay? This is the labio. And we had a lingual. We need a labiolingual at the cervical. But as in the previous lab, we will extend the thirds before starting. We will extend the thirds that will represent the 3/3 of this length. We have 9 millimeters, so we need 3, 3, 3. It will be equalized into 3/3. I need a bisecting line here because I need to make the divided to the one measurement. So we had, unfortunately, I said we have only 4 measurements, but at the cervical third, 5 millimeters and 6 millimeters. This is what? This is the distal or mesial aspect. Okay, this is this is a distal aspect. It's not different because I will add the carving, add the features. So at the cervical, I need only what? 5 millimeter. And the first, assign 5 millimeters here. And regarding to the bisecting line, assign only 5 millimeters. Yani you need 2.5 in each side. Okay? This is my 5 millimeters. One here, one here. Okay? I will assign within the marker to make that visible. And you can see this is the first assigned. This is from the measurement. But in this reference, he used only the crown. He used the 6 millimeter. So you can see here, this is a 5 millimeter cervical. You can see the labiolingual diameter of the whole crown. It will 6 millimeter. So yeah, that's mean when I put it my vernier here upon the shape of the lateral, we had 2 contact only at the cervical. When I put it my vernier here, the poly gauge, there is 1 contact here, there is 1 contact here only. Because if I make a contact here, there is no equal one in the other side. So it will contact only in the maximum coverage, maximum convexity. So there is no problem. I will depend it upon the shape. If my base, it will be correct, and I have 1 length, just add the shape of the crown at the distal aspect. So I will need now 6 millimeters. It will just put it upon what? At the cervical third. This is the 5 millimeter. Just put it here. Just put it 1 millimeter more than the cervical. So there is no difference here. But put it in your mind, there is what? There is a curve here. We will start from the 5 and I will rise the measurement to the 6. That means I will construct a curve. It is not a straight line. This angle here, it will be produced by this approach. When you start from 5 to 6, you will start with the curve. In the prosthesis, this curve, it will be blended within the tissue. Okay? We don't have a straight line at the margin. Okay? Because we want to make a curve to accommodate the tissue surface in the patient mouth. So put it in your mind, this measurement is a natural measurement and will be essential for the prosthesis. Okay? So I need now only, sorry about that conflict. I need only, this is 5 millimeter, this is 60 millimeter. So I will adopt there is no measurement, only the for measurement, okay? Because there is no any benefit to make a measurement for whole of the crown. I mentioned that in the previous lab, in the presentation, in the introduction. So I will start what? With the shape. I will assign my shape here. You can see we had 3 thirds. The maximum convexity, the maximum width at the cervical third. Maximum width at the cervical third. So we have a tapering in the middle third until to reach the tip of the triangular at the incisor edge. What I need now, I need to make a curve. This is a 5, this is a 6 millimeter, and I alter my inclination toward the incisal dot, okay? Within what? Within a curvature here. I will construct a curvature here. I will transfer this shape, okay? I will transfer the shape from the labial. Just, you can see I will make these aspects, okay? I will make these aspects. So, this is the labial. This is the maximum convexity here. This is the maximum convexity because it is a 5 and we have 6. So we are in the cervical third now. This is a cervical third now, okay? What I need now, I will change my curve toward the central. Yes, I'm sorry for that conflict. Yes, I will repeat it. This is the labial aspect. This is no shape of the lateral incisor. This is just the outline, okay? So I need to start from the 5 and I change it to the 6. That means I will start with the convexity. Tamam, I will make adjustment to the zoom. I will repeat it, don't afraid. This is the 5 millimeter, okay? And this is the 6 millimeter. That means I will start with the curve, with the maximum convexity. This is a curvature. It will be started from the 5. It will be increased at the 6. So this is only in the cervical third. This is a cervical third, okay? After that, at the cervical third, I will alter my curve, okay? I will alter my curve as in the reference. You can see this is the cervical third. It will start to decline toward the middle portion, okay? I'm starting from here to reach to the maximum convexity. This is a 6 millimeter. So don't extend the maximum curvature because the 6 millimeters enough are here. It will be decreased. It will be diminished, toward the incisor. So I will start to complete my curve until to reach to the tip of the incisor. It is very easy to apply it here. So this is the 5 millimeter. This is the 6 millimeter. So this is the tips of the lateral incisor, sorry. So you can now make a curve here until to reach to the tip of the what? To the tips of the block. Okay? Don't make a severe curvature. You can leave some axis of wax to assure that a sufficient material for the carving, okay? Don't make it severe, okay? Because you had a base, you had a correct base. Don't be fair about that. Just make a curve, start to make a curve, okay? So now, what I need now, this is my curve, okay? This is the 5 millimeter, the maximum convexity will be here. On the middle third, I will start to make the curve here. So this is the 5, this is the 6, and this is the maximum convexity here. This material, I don't need it. It will be what? It will be cut it from the labial aspect, not here, okay? I will cut it from here. Okay? To produce the curvature of the lateral incisor. But I think this curve is very severe. Let me to correct it. This is the 5 millimeter, this is the 6 millimeter. So I need to add the curve here. This is the maximum of the curvature at the curve. And it will be changed to what? Changed to the tip of the block. So this is at the labial aspect. We finished that now. Now what I need to make the lingual aspect. This is a roundation tip. I will leave it to the incisor. Don't make it very sharp, please, because we have incisal edge, okay? So please start from here. Start from the cervical, from the 5 to 6. This is the maximum convex until to reach to make a slightly concave. because the marginal ridge of the lateral, it will be raised. It's not as in the central incisor. I will make a big fossa, but not marginal ridge. You can see, this is the marginal ridge of the lateral. So this is a 5, this is a 6. So I need a slightly concave. You can make it, don't make a severe, because just make an outline, okay, and we'll add the feature. I will add my carving, okay. This is not a final shape of the lateral, but it will be assign the good principle for the carving, okay, to avoid the mistake, to avoid I need a fundamentals to start with the carving. So this is very easy because I have a 5 millimeter here, because in the lingual side we have the 5 millimeters here, and we have a 6 millimeter. Please pay attention to this. This is the 5 millimeter. This is the 5 millimeter. This is the 6 millimeter. So we are already in the cervical third. Okay. Make sure we are in the cervical third. Make sure we are in the cervical third. You can see the maximum convexity at the cervical third, but at the beginning of the cervical third. Okay. So at the cervical third, I will start with the concave. Not as in what? As in the labial aspect. It is very easy to start with the maximum convexity at the cervical third. So alter your shape to what? To make a concave, but don't make it severe. Okay, this is your concavity. So you can see I need just this point. For me now, I need this point now. I need the maximum width at the distal aspect or the mesial aspect, okay, to guide me for a proper distance, a proper volume, a proper shape to the lateral. I will adopt my information about the carving, about the anatomical landmarks of the lateral incisor. So this is very essential to preserve, to maintain the shape of the lateral, to maintain the maximum width, the maximum convexity, the maximum concavity, okay? So this is the maximum convexity here. This is the concave shape here until to reach to the top of the block. So don't start with the cutting. Make a double check. All measurement is correct. This is the 5 millimeter. This is the 6 millimeter. We had a curve toward the top of the block. So this is the 5 millimeter. This is the maximum convexity from the lingual. So I will change my curving to make a concave here. And this is the top of the block. Now, what I need now? Make a cutting. Please make another check. Make another check, please, because this is a cutback technique. I can't make any error because to avoid the repeating of the block, okay? So make a final shape here. Take your set area to دروي برو مشكلة مني بس cutting معايا أتو دانيشة أتشوا أتوش دروي Signed after I had assigned all shape of the distal aspect or mesial aspect to construct what? To construct the labial aspect. Okay? According to the measurement, according to the shape, now you can start with the cutting. So this shape, it will be removed. But when I make a cutting, according to the measurement, according to the outline. So start with the slicing. You can use the lateral carver to avoid the has work hazard, but for the time I will use it. Okay, this is my responsibility. But for you, please use the lateral cover. For not wasting the time, I will start with the biggest slicing. But for you, don't make a slicing. Don't make a severe slicing. Don't make a severe slicing. Okay. But please, when make a slicing, please avoid cutting the maximum convexity, maximum width, minimum width. This is a guide. This is a reference for you. This is a benchmark for making a shape. Don't remove any here and here, okay? I means when make a cutting, maintain, preserves the maximum width because this is a final measurement. I need just to construct the shape. Don't alter the measurement. If you need to make a roundation now, you can, but my recommendation, don't make it. Make it within the angles. Construct a final shape within the angles. After that, just added the roundation. So the lateral, it constructed with the 2 minutes only. Because you will add only the roundation. This is the same concept. It's used with the milling machine. It will start with the one block from the outer surface, and the milling machine is not make a changing to the bears. It will make a severe one, the carbide one, okay, to cutting the outline. After that, added the smooth one to add the final feature. So what I mean now, you can see this is the 5 millimeter and 6 millimeter. So now I need to make this curve according to the measurement. Make this curve according to the measurement. This is the neck of the tooth at the cervical third. It will be had a curve to accommodate with the gingiva tissue, okay? We don't have a straight aspect at the right. لا إله إلا الله. أنا أكون في لكتانا تأثير طلبي حمودك. Pay attention to the screen. Now, please, what I mean, the 5 millimeters, the minimum width at the cervical. When I increase to the 6 millimeters, that means I had a curve here. Don't make it as straight. Please don't make it as straight. Because with the curve, it will start from here to start with the initial concavity. Okay? Initial convexity. Okay? So this is the start point. And I will reach to the 6 millimeter here. You can use this shape of the lacron, okay, to make a final shape to the outline. Please focus about the outline, because the outline, it will be make the carving visible, make the carving durable, okay? It will preserve your shape, okay? So after that, we will add the features, okay? Marginal ridge, fossa. So when you complete your I will add the micro layering to the tooth. If you want it without any aesthetic, you can make it a full anatomy, added only stain. This is not aesthetic one. The aesthetic one, I will start with the تقريبا سطح بنزاي lateral, سطح هشتاي central. I will add another layering. It will be called a micro layering, because I will add more aesthetic to this feature. So I will put it the marginal ridge as individually. I will put it the middle third individually. So please pay attention to these features, okay? This is the work zone for you. This is work zone. As a technician, this is a work zone. We need a chroma in the cervical third. How can I do it? Because I want to make the curve of the cervical third, and after that I will add the chroma. Because if there is a straight line, I will lose the reflection and the what? Equal reflection and absorption. I need the shape. After that, I will deal with the light. The shape, it will be impact, influence the shade, the aesthetic. So start with the proper shape. After that, add the features. It will involve the shade, chroma, hue, all features of the aesthetic. It will be added with the proper shape of the tooth. Okay? So this will be impact the reflection and absorption. There is no straight line, straight aspect. It will be produce same aesthetic as in the curve one. Okay? So this is the starting point to the make a curve here, because we have a 5 millimeter here. So I reach to what? I reach to the 6 millimeter. Yes, good. So this is the 6 millimeter. In the 6 millimeter, I need to make a removing? No. It's impossible because it is a maximum coverage. May I make a roundation in the distal and mesial? But in the center, don't make any. Make a roundation, I will need it. Okay, but it's a maximum convexity. I will make a tip of the maximum convexity and I will start with the other roundation. Okay? Not in the center. Because there is no all aspect is roundation. We had a curve. We have a roundation, in particular in the lateral incisor. Okay? So after that, I'll alter my work to make a tapering curve toward the tip of the to the top of the block. So this is very visible now to make the tapering toward the top of the block. So you can see when I make the curvature here, the roundation of the lateral, the distal and mesial, it will be produced easily. So when I make a roundation here, not roundation, I will make a tapering in the curve, okay, toward the central, toward the top of the block. You can see the contact area, it will be produced. You can see this is a contact area here. So you can enlarge the shape to 1.5 to avoid the mistake, okay? You can make it. But when the one proportion, you increase in this side, you may need to increase in the other side. So I need a severe tapering toward the top of the block. But equal slicing, please, equal slicing. To produce one surface, one parallelism, one shape. So don't make a severe, just make a roundation here. Make a reshaping to this outline according to the, make the surface according to the outline here. Now, don't make a lingual now, just make a double check to the curve and all feature of the outline. So I had a sharp edge here because I don't need it, because I had a severe curve here toward the cervical, because the measurement, it will start from the 5 and rise to the 6 millimeter. Now you can make a roundation here, but don't make it now. Make it in the final stage after to produce all features and outline of the lateral incisor. Make sure the parallelisms of the curve, it will be equal in all hole of the crown. Make sure all aspects, it will be cutted equally. Why? Because when I make a distal aspect or axial aspect, the other side, it will be produced according to my side. So don't make a carving in this aspect according to your shape and leave the other side. The other side, it will be produced according to what? according to your cutting. So when you use the lacron or carver, don't make it in the one aspect, one portion here. Please make one equal slicing. It's roughly equal in the all aspect. So the maximum curvature, it will be still. When I make a roundation here, it will be naturally produced, naturally. Yes. Now what I need now to make a lingual aspect. I had a shape here. This is the slightly concave because we have a rise in the marginal ridge and the lateral incisor, and we have a deep fossa and wide fossa. So this is the maximum convexity. Please preserve this curvature because it will represent the maximum width at the cervical. Okay? So I need now to make the maximum width at the cervical. So you can make a double check and now start with the removing the excess of wax. Removing the excess of wax. Removing the excess of wax according to the outline, according to the lines, according to the shape of the lateral incisor from the distal aspect or mesial aspect. Don't make a severe slicing, but for me I will start it because to preserve the time. But now, your job now, your task, just maintain this width. Don't remove any excess material from the maximum width. It will be altering the measurement. Yeah, the line, yes. I mean the minimum width and the maximum width. Because it will assign according to the measurement. So don't alter it. Why? This is not, the measurement is not big deal. I use the measurement to produce the shape. Okay? If you want to make the big lateral, okay? Just increase the measurement. So the shape, it will be preserved by the measurement. This is our objective. It's not measurement. May we need the lateral incisor bigger than the other one. I need a proportion. I need a proportion to this shape. Because it is still at cervical, we had a minimum width. At the cervical third, in the cervical third, when we raised, I had a maximum curvature. So this, I can make a measurement to this feature. So the objective is not within the measurement. The objective is within the proportion of the teeth. Okay? So it's unnaturally to make a central is without a proportion. It will be not vital. It's not appropriate to put it in the patient mouth. Okay? There is a conflict. There is a defect in the patient mouth. So use the proportion. Increase the volume of the central, decrease the volume of the central. Up to you. You have the freedom to make that because the patient is not sane. But we start with the standard point. Now I will make the lingual, make a slicing here, but please preserve the incisal edge. Because we have a short spine of the incisal edge at the lateral incisor. Okay? Don't remove a severe from the lingual or from the incisal edge. So please don't exceed this line. This line, when I make a removing here, okay, you can make it a concave to start with the fossa. You can make it. But leave it now. Please, instead of that, maintain or preserve, please, this line. It will represent the marginal ridge of the lingual. If you remove it, the lingual aspect, it will be distracted. Okay? If you want to start with the fossa, up to you, but my recommendation, leave it now. Maintain this curve. You can see this is the 5 millimeter. Sorry, this is a 5 millimeter. This is the 6 millimeter. Okay? You can increase it with the 0.5. You can't make it. But we had a curve here. That means the start point, the initial point to start within the convexity, it will be start from here. This is the 5 millimeter. So I will make accommodation with the gingival third. So you can remove the axis of wax of the lingual. You can see this seems very large lateral incisor, but don't afraid from this outline. This outline is very useful for you. Why? Because I have a measurement. After that, in the further stage, I need just roundation within what? Within the measurement. When I make a roundation, I reach to the maximum convexity, my measurement, I will stop. So otherwise, I will make a roundation. So regarding to the measurement, within the roundation, the lateral, it will be constructed. As we mentioned, we had a wide fossa in the lateral incisor. It now clarified within the outline. Now, I just need to make a final shape according to the outline. So in the further stage, I just need to make a roundation. I will complete it. Thank you for attention. For the lateral incisor, we will make a revision to the outline for you. Okay? So in the previous lab, we adopted the outline for the lateral incisor. Okay? So you can see now we had a width at the cervical and the width for the whole of the crown. Do you remember was the width of the mesiodistal width of the crown at the cervical? It was what? 5 minutes. And for the whole of the crown? 6? 6.5? Yes. So I can make a measurement to my mistake now, because when I make a cutting, I had to 0.5 millimeters for carving to avoid make a corruption to the contact area. So I need now 6 millimeters, that's right? 6 or 6.5? 6.5. You can see mesiodistal width of the whole crown. So if you can see now 6.5, you can make it 7. This is, I think, is correct, because this is my contact area here and here. It will be 6.5. Okay? So I will make a double check for the contact area if I had axis of wax, because our agreement to put it 0.5 for carving to avoid mistake, because we are beginner with the practice. Okay? So this is 0.5. You can leave it for roundation. There is no any blame for that. Okay. At the cervical, we had 5 millimeter or what? 5. At the cervical? 5. You can see 5 millimeter only. So you can make a double check to the 5 millimeter here. This is 5 millimeter. It's correct. Okay. From the mesial aspect or from the distal aspect, this is my mesial, this is my distal. From the distal aspect or anywhere, there is no any different. In you can see we had a labiolingual 6 for the whole crown, and we have 5 for the cervical. Let me make a double check if I had a mistake or axis of wax. This is a 5 millimeter. Sorry. This is 5 millimeter. If I had 0.5, there's no issue about that. We would make a carving. We would make a roundation. And I need what? 6.5 for the height of the crown? 6 or 6.5? Huh? 6 millimeter. Now I will make a double check to the 6 millimeter. I think I had axis of wax here. You can remove it. So this is, it will called outline of the lateral. This is very essential stage to assign a proper measurement, a proper proportion, okay, to the shape of central, okay? We don't need a particular measurement. We need a proportion of the lateral incisor. And after that, we will assign the shape of the lateral. You can see within the outline, there is no final shape of the lateral. But you can see we had a severe roundation from the distal. We had obtuse angle or roundation at the mesial. You can see we had a slightly convex here. We have slightly convex here. We had slightly convex beneath the contact areas. We had a roundation in the incisal third. So regarding to the cingulum, I need this contour to make a cingulum. So I need this contour regarding to what? Regarding to the shape to make a marginal ridge. So this it will be constructed the marginal ridge. Put it in your mind. The marginal ridge in the lateral is a bulky. Okay, had a thickness. We had a heavy marginal ridge in the lateral. So we had a deep fossa in the lingual area. So this wax, I will need it. I will make management within wax to produce a final shape of lateral incisor. So regarding to the cervical third, after I made all features of the labial and the lingual, I will make aspect of what? Of the distal and mesial. So now you can assign the height of contour that regarding the contact area. This is the maximum curvature. Need to be removed? No. So I will make a roundation around it. Just a roundation. So consequently, we need a roundation in the lateral. You can make evaluation from the top. I need to make a roundation in the lateral now, because there is a radial aspect. We have a roundation in the labial aspect. From the top, according to the shape of from the incisal aspect, I need this roundation, okay, for the lateral. You can see this roundation. I will make it. Now I will start with the roundation to remove the axis, but please preserve the maximum width, the maximum curvature. It will be located here because we have a labiolingual width at this area in the cervical third. So I need to make a roundation here, So maintain the maximum coverage, maintain the maximum width. After that, make a roundation to whole of the crown, but without axis removing from the maximum curvature. Because the maximum curvature, it will represent the height of contour, the maximum convexity at this line. So this is the maximum convexity. Around it, I will make a roundation to whole of the crown. So just make a roundation. We don't have angles as in central incisor. So this is the maximum coverage to represent the contact area. Don't make a remove of wax from that area because I need it for contact area. So just keep removing and make a roundation to the labial aspect. And you can depend it upon the maximum coverage as a reference point to start to perform the final shape of the labial aspect. So please don't speak about the grooves and mamelon now. Just make aspect. Just make a labial aspect. I need a curvature now. Don't make any advanced anatomical landmark now. Because I need the correct outline. I need a correct curvature now. I need a correct contact area. I need a correct proportion now. So my correct proportion, I had a maximum coverage here because in the cervical third I had a measurement here. So I need to preserve this curvature. In the other area, I will make a roundation regarding to the principle of lateral. So this is the shape of the lateral. You can make evaluation to the lateral from the top. You can see we had a roundation here. We had a roundation here. So how can I how can I control this, this curvature? This is very easy. I had the reference point here, the maximum coverage, regarding to the labiolingual measurement. So I don't remove any axis from that point. After that, I don't remove any axis from that point. Okay? After that, I will make a roundation in accordance to the principles of the lateral. So we had a roundation shape in the labial aspect. Okay? So just keep going to make a roundation. Just keep going to make a roundation to the labial aspect. But in condition, I need to preserve the maximum coverage at the cervical third. The maximum coverage at the cervical third, it will be located here according to my measurement. You can see now, it will be produce the roundation in the labial aspect, and I had the maximum convexity in the labial aspect. It will be located in the center. So this maximum convexity, according to the measurement or the proportion. So now, just keep going to make a roundation, because the axis of the wax, it will be removed and leave the correct shape. Just keep going and don't remove any wax from this area. Just keep going to make a roundation. So leave it now. Don't make a final shape for this aspect. Okay? Now you can make what? Can make a tiny adjustment here regarding to the cervical, regarding to the marginal, to stimulate the junction, cemento-animal junction. I will make it with the root now. So please now I need to make the lingual aspect. The labial aspect is neat to added feature. Don't make it now. Don't make it now. Just make the outline of the lateral. What do you know about the lingual aspect? The lingual aspect, we have irregular surface. We have a tapering shape. We have thick marginal ridge, medial marginal ridge and distal marginal ridge. And we had a deep fossa, not very deep, but in comparison with the canine and the central, we have a deep fossa. Okay? So we had a cingulum, but this cingulum, it is not very big, but bulky, that will continuous with the shape within the marginal ridge. So I need two marginal ridge with a thick, with a thick outline. It will be connected with the cingulum. So the cingulum, it will be ended here because this is according to the measurement. The cingulum, it should be located here. Okay. regarding to the tip of the cingulum or direction of the cingulum, it should be located in the center. Okay? Now, this is the maximum point. I will assign it now. This is the maximum curvature of the cingulum. Okay? It's located here. Don't make any changing to this curvature because this is the maximum convexity of the cingulum. Instead of that, you can remove anything around the maximum coverage. According to what? Because I already had a tapering in the lingual axis, in the lingual aspect. So I need to remove this aspect because I don't need it, because I want to make a tapering toward the cingulum. You can see now, if you want to make a comparison to the reference regarding to the lingual, you can see, pay attention to this slide. I need to make a tapering toward the lingual, so I will start to remove this area until to reach this shape. But you can make a note about this area. There is no any removing from this area because this is in accordance to the measurement. So this angle, it will represent the marginal ridge. It just need to make a marginal ridge within the roundation, within the final contour. So I will make practically transfer this formation. This is the maximum coverage. This is a maximum coverage curvature here of the cingulum. So I need to remove this area of waxing to produce the tapering shape, because in the lingual aspect we have a tapering shape until to reach to the center of the cingulum. But don't make it severe. Just make a tapering to the lingual aspect, but not make it severe. Where is your reference point? The reference point is the contact area. The reference point is the cingulum area. So just I need to remove the excess of wax, and I keeping the removing until to reach this point. I don't make anything in this point because this is according to the measurement. Just need to make a roundation upon it. When I make that step, the contact area from the lingual, it will be clarified exactly in accordance to the measurement. This is the contact area in the incisal third. This is the contact area in the junction between the middle and the incisal third. So keep the removing or slicing from this area to make a tapering toward the lingual. Keep going to remove the excess of wax to make a tapering, and you can evaluate it from the top. This is the tapering are needed to the lingual aspect. Now, don't make a severe removing. To be sure there is a sufficient wax that I will need it in construction of the marginal ridge. I need two marginal ridge here, two thick marginal ridge. It will be thick, not as in central incisor. We have a bulgy marginal ridge here, marginal ridge. So now you can start with the fossa. Why? Because the marginal ridge, it will be constructed automatically when I make a fossa. Just keep going to remove this area in the fossa, in the lingual aspect, to produce a fossa, and make evaluation. I need a fossa that will be surrounding what? By what? By incisor ridge, by two marginal ridge, by cingulum. So pay attention to that margin, it will be bulky. So don't remove, don't make a wide fossa. Leave a wax to make a marginal ridge here. So I need to remove this area only. Don't make it very deep. And make it in accordance to your objective. Your objective to produce two marginal ridge here, and the incisor ridge, it will be, all of them, it will be automatically produced. Now you can make a check for the fossa. Don't remove a severe amount of wax from this area. Just make a check and make a cleaning to this site to evaluate it if I need to remove more than this amount. So now I need to make another tapering because I want to produce a cingulum that will be appropriated with the two marginal ridge. So make it gradually. Don't make one feature 100%. Make 3-step, 2-step, and stopped to make another feature that will be appropriate with the other. So I will check my cingulum regarding to the marginal ridge. I will check my marginal ridge regarding to the cingulum. So you can see I stopped to the marginal ridge because my cingulum, it needs another correction. Don't make it a final shape of any features. Instead of that, make it in a company task, okay? So I think the tapering in the lingual surface now is very appropriate. No need to remove any excess of wax. Now I can make the evaluation to marginal ridge. It will be reached to incisal third, and it will be connected with the incisal edge. It's very easy to make it because you had an outline, you had a measurement, you had a reference now. Sometimes if you add advanced features, you can put the grooves here in the cingulum, but I don't need it now. Just keep going to make a thick marginal ridge in the lingual and centered cingulum that will connect it with the incisal edge. This is the main criteria that will be found or obtained in the lateral incisor. Now I will make another check to the distal aspect regarding to the produced regarding to these features that will be produced with my work. So I need another roundation here to provide a good proportion regarding to the angle line at the labial aspect. So I can see the roundation here, and I will make a roundation with the tapering in the lingual side. The roundation here, and I will keep going to make a roundation that connected with the lingual aspect. Regarding to the other side, I need to make another roundation here. It will be appropriated with the lingual aspect because we had angle lines here. Now, I can evaluate my labial aspect to grant a final shape of the lateral incisor at the labial aspect. So you can see the lateral aspect, it should have a rounded shape, more roundation. So now we can make evaluation to the what? To the angles at the incisal edge. Make a double check to the roundation. At the mesial, we had, At the mesial, we had obtuse angle. And on the distal, we had a severe roundation. So now, this is the, sorry. I will make a severe roundation here to represent the distal aspect. Okay, so we had a short span of the incisal edge. From this aspect? Yes, you can make it. Just make a severe roundation in the distal aspect and make a roundation in the mesial aspect, because we had a contact area. I think this is the distal aspect. We have a contact area now here in this portion, and we have a contact area in the incisal third. You can make a check at here, yeah. So the contact area should be located at the incisal third, and the another one, it should be located in the junction of the between the middle and the incisal third. For what? For the mesial, it should be located at the incisal third. It should be located in the incisal third. You can make it towards cervically, or to be more specific, it will be injection between the middle and the and the junction between the middle portion and the incisal third. This is the final shape of the lateral from the aspect, from the incisal aspect, because we have a roundation here and we had obtuse angle here, and we have a short span of the straight line in the incisal edge. Now I think you can add the grooves in the aspect, in the labial aspect, but the developmental groove of the labial aspect is very shallow. Don't make it deep, okay? You can add one here, and you can add another one here, but not make it very deep. It's all shallow developmental groove. It will represent the will be just to make to clarifying the labial ridge at the labial aspect by using depression here with a shallow shape to represent the labial aspect and clarifying the labial ridge. So regarding to the cervical third, regarding to the cemento-animal junction, we have this measurement. We want to transfer it to the cervical portion. You can see the curvature of the cervical line. At the mesial, it will be 3 millimeters. At the distal, it will be 2 millimeters. So what do I mean? From the mesial, if I had a mesial, I need just 3 millimeters. So that means I can add the curvature, put it the 1 to 3 millimeters. 1, 2, 3 millimeters. This is the mesial. just put it here. This is your elevation of the curvature. And this point. So I need to produce the curvature. It will be extend to represent the cemento-animal junction with the height of the 3 millimeters. But don't make it deep. Just a line without any anatomical features. Just make a line to make a separation from the crown and the root. Three millimeters. At the distal aspect, we have what? We have 2 millimeters only. That's right, or 2.5? 2 millimeters. So you can make it without measurement, but make the distal aspect lower than the mesial aspect. And after finishing the roots, I will connect the crown within the roots according to this shape of the line, according to this curve. So what that means? I need a curvature to represent the cemento-animal junction. This area for the crown and the another area for the root.
You need for the tissue.
Yes. So this is, I think this is a final features of the lateral incisor. I need it now. Just I need two thick marginal ridge. This is the thick marginal ridge in the lingual. And I had centered cingulum. And I had incisor ridge here. It will be connected with the two marginal ridge. And I need to what? I need to contact area in the incisal third. Regarding to the mesial aspect, I need contact area in the area of the incisal third towards cervically, or could you can make it specifically with the junction between the middle and the incisal third. So I need a maximum curvature in this area regarding to what? Regarding to the measurement. I need a maximum convexity here. So I need a curvature toward the incisal aspect, to incisal region. I need a shallow depressions in the labial aspect, and that will produce the labial ridge. This is the main feature I needed in the lateral now. And I can, this is not necessary to make advanced features with the wax now, until to reach the good level with the practice. So don't add any supplementary features. Instead of that, make a good outline, a good shape of the lateral with the fundamentals features, with the main features. After that, you can add the advanced one. Okay? Thank you for listening. So please, regarding to the lingual aspect of the lateral, we need two thick marginal ridges. Okay? This is what I mean. So regarding to the prominence of the cingulum, it should be in accordance within what?
Combined.